Poor fertility does not just mean trouble conceiving anymore. It tells you so much about your whole body as health too. Think of it less like a single event and more like a big picture report card. Bad fertility often hints at bigger problems inside you. These include things like bad metabolism or constant low-grade inflammation. Conception demands tons of perfect teamwork from your body parts. So struggling with fertility might be your first small alarm bell ringing loudly. That signal warns you about deeper issues brewing underneath the surface. Your menstrual cycles tell amazing stories about your inner workings. They stay super important even when you are going through perimenopause. Those changing times right before menopause hold lots of good data. Looking closely at your cycle phases reveals how your body is really functioning. And guess what? This wisdom extends way past actual menopause too. Past patterns help us see what is happening with your cells today. We are talking about connecting yesterday is whispers to tomorrow is strength. Modern thinking says we need to start hormone fixes sooner. Do not wait until your periods totally disappear to think about support. Therapy can actually help protect your health during perimenopause. Maintaining balanced hormones is huge because humans live so long now. Rigid cutoff lines telling you to wait feel pretty unfair. Doctors should look at keeping your hormones steady for daily living. Protecting your bones and maybe even fighting off dementia starts now. Managing root causes keeps your ovaries healthier for longer. Things like catching thyroid issues early matter a lot. Treating endometriosis and ditching nasty toxins makes a difference. A clean diet and mindful movement also play a massive part. Environmental stuff like tiny plastics definitely adds to the load. Endocrine disruptors pile up slowly over time, sadly. But listen close, because fixing your foundation is step one. Age certainly shifts the game when it comes to having babies. Chances absolutely dip steeply after you hit 35. Yet, if you have been pregnant before, your luck stays stronger. Knowing exactly when you ovulate beats just counting bleed dates easily. Subtle slips in your cycle timing send clear messages back to your brain. Listen to those fine details instead of ignoring them altogether. Do not let fear keep you silent about your health narrative. The full breakdown on navigating these tricky waters awaits you. Find our complete guide linked below right now. Subscribe so you never miss this vital conversation. Check out Profile for podcast summaries.